I'm Kathy Pike, and I'm co-chairing this event with Bev Du, and we'd like to welcome you to the second New York City Global Mental Health Forum. And I'd like to begin with turning the microphone over to Bev, and then I'll say a few words following.
Thanks, Kathy. So I just want to welcome everybody. We have people here from all over the world. Thank you so much for being here and being part of our community. So just to give you an idea of why I had this idea last year to start a conference like this, and it's through meeting many of you guys out here in the audience today, talking in small groups, but realizing that there was a need for a community here in New York. So my journey in global mental health kind of started when I was a medical student, and I decided to go abroad and go to rural China for the summer. And I learned, I guess, basically two lessons there. And the first is that human suffering is so universal, and that I kind of thought I would be finding very exotic types of behaviors and et cetera. But what I really learned was that sadness is sadness, and and people are people. The other thing that I realized too was that doing this kind of work is incredibly lonesome. And I don't know if many of you would relate, but when I was in China, we were living out in the countryside with not much electricity and amongst people whose language I didn't speak so well. And we ended up drawing hash marks on the walls to count down the number of days we still had left there. Because it was incredibly lonely and really difficult. And so for those of you who had spent a lot of time in these lonesome places where you were the only one who had a certain ideal in mind and trying to accomplish a certain mission, very different than everybody else around you, I hear you, okay? So out of those two ideas was sort of why I decided that we needed community in this field of global mental health, that we are people who decide for some reason to go out into these places where we would be very alone, but also people who very much understand that human suffering is so universal. And that we together could be a community and support each other in that kind of work. It takes a lot of bravery and energy and strength to do the things that we do. And so that's kind of why we felt that New York, at least, with the incredible amount of energy and work that people are doing here in the city and nearby and all around the world, that we can become a community here and meet in person as much as we can. So this year, I really have to, I'm so grateful for Kathy Pike to have really taken this idea and made it a global project. And I think thanks to Kathy's work and with the Global Mental Health Initiative at Columbia, this went from an idea to like an established kind of program. And she's really taken it to another level. And I'm so grateful, that she's going to be, heading this off from now on. So I just want to give a round of applause to Kathy and the great work that she's done. I just also want to say a couple words about if you guys are interested in continuing a relationship beyond the face-to-face meeting that can be kind of brief, that the Society for Emotional Well-Being Worldwide is a nonprofit organization dedicated to keeping those of us here in touch with each other, even when we are off in, Kenya doing our work, to be in touch with people back home, people in China, people from all over. We're an online community. We have our own website. And then I'm just going to play like a short 30-second video about who we are. And our president, Ali Sharma, who's sitting in the back there, will be speaking later as one of our panelists.